When it comes to Medicare, many people aren't really sure how to truly compare your Medicare plan options. So in this video, I'm going to show you exactly how to do that. When my dad and I went through Medicare, we were shown things like premiums and basic coverage details, but not shown the most important costs. We really weren't understanding how Medicare plans worked and how to truly compare them. So I'm going to break this down in detail in this video. I'm Emily with the Medicare Coach, and after helping over 100,000 people, including my parents, I've discovered a process that you can follow, everyone can follow, to easily make your right Medicare decision, no matter what state you live in, what your healthcare needs are, what your doctors are, your medications, any of those things. So I will also share some other extra resources down below to make your life simple and easy, but let's hop into this so you know how to compare Medicare plans. So again, when I went through this with my dad, or when our clients come to us initially, I oftentimes hear people say, well, I was shown a couple plans and I had to pick between G and N, or I was shown a plan and had to pick between companies, or I was shown a plan and pick the lowest premium plan. But the thing is, if you're only looking at those details, you're missing a bigger impact of how Medicare works and how to find the best plan for you. And because of Medicare's guarantee issuance rules, we want to get the right plan when you first join so that you can see your doctors, have the lowest costs, protect yourself, your finances in the future, have really good healthcare. So I want to show you again how to do that. So I'm going to share my screen. So one of the best places to start to compare your Medicare plans is by going to Medicare.gov. Now, Medicare.gov is not perfect, but it is a good starting point that you can go access without having to deal with, again, insurance agents or the companies. So this is a screenshot of the Medicare.gov website as it looks today. And in the top right-hand side, you'll see a button that says Health and Drug Plans. And if you click on that kind of down caret next to that, you're going to have a further menu pop up below that. And you're going to want to click on this Find Health and Drug Plans in the upper left-hand corner. Now, once you come to that page, it's going to ask you for things like your zip code, your county. Do you get financial help? Most of our clients don't qualify for extra help or for Medicaid, so the answer is usually, I don't get any of those. And then they're going to ask you, what type of plan do you want to research? It'll either be Medicare Part D, Medicare Advantage, or Medicare Supplement. Now, I'm going to walk you through a real life example today so you can kind of see how we think about it. But we'll look at things again like your doctors, your medications. Where are you? Does your state have unique rules? What are your priorities? What's your overall situation to guide you down the right path? So let's continue with this client. With this client, I got his doctors. So he has 3 doctors, Dr. Aaron, Dr. Brian, and Dr. Oliver. Now, I researched which Medicare Advantage plans and which overall Medicare plans the doctor accepts. So Dr. Aaron takes Aetna, Blue Cross Blue Shield, Humana, and Original Medicare. Dr. Brian, Blue Cross Blue Shield, and Original Medicare. Dr. Oliver, Aetna, Blue Cross Blue Shield, UHC, or UnitedHealthcare, and Original Medicare. So what does this mean? When I initially go through this process, which is why we think about Medicare in steps, and why this is the first and most important steps, is I'm going to ask myself, which plan do all your doctors accept? I believe that Medicare only works, or Medicare works best, when your provider accepts them. I say this because I've seen people who pick out Medicare plans, and then they have a health scare, a health issue happen, and they want to go to this doctor, and they find out that their Medicare plan does not cover this doctor. And now they're like, shoot, what do I do? I can't afford the doctor out of pocket, and I can't afford for Medicare not to cover it. So now they have to decide. Like, they can no longer go to their best doctor. They have to make kind of trade-offs. And that's not a great place to be. And if you plan in advance, you can avoid making those trade-offs in the future. So in this situation, I'd say this is interesting. All of my clients' doctors take 1, a Blue Cross Blue Shield Advantage plan, and 2, Original Medicare. So if they want to see all 3 of these doctors, and this is a priority for them, then those are kind of their only 2 options when it comes to Medicare plans, right? We've now taken dozens of plans and narrowed them down into really 2 main categories. Now, if my client says, okay, well, actually, my only really important doctor is Dr. Aaron, I'd say, great, well, then we can do Aetna, Blue Cross, Humana, or Original Medicare. So we start off by understanding who are your doctors and what Medicare plans they accept. Now, I then ask, well, what are your medications? And this client takes levothyroxine, rovastatin, and Tresiba. Pretty common medications, not a, I'll say big deal, but I'll show you why this is going to be a big deal here in a second. So I'm now going to say, okay, you you are considering Medicare Advantage, let's see which Advantage plan would fit you best. Again, I know the plans that your doctor accepts. I know your medications. Let's put the two of them together and figure out what makes the most sense. So if we begin with just the Blue Cross Blue Shield / Anthem plans, this HMO plan is his best option. It's called Anthem Medicare Advantage. It's an HMO. It has a $0 monthly premium, a deductible of $0 for health and $325 for medications, and a max out-of-pocket of $9,250 for in-network providers. Now, his medication cost is the real kicker here. His medication estimate for the calendar year is $10,392.96 if he gets them at CVS. Now, I have looked at other pharmacies and that will not save him money. The issue with him with this cost is that Tresiba is not covered by the one Blue Cross Blue Shield plan that all three of his doctors accept. So I say, okay, are you going to be on Tresiba? If you are, this is not our best option, but we now have to choose between getting Tresiba covered and having all three doctors covered, at least on the Medicare Advantage path. So again, I'm looking at costs, I'm looking at medications, doctors, all those things. So my initial thing is like, red flag, I don't love this for this client. That's a crazy amount of money to pay for medications. So I'll say, okay, well, what other options do we have out there? Now, come to find out, there's a plan through Humana called Humana Choice Give Back. It has a monthly premium of $0 a month, a deductible of $0 for both health and medications. It has a max out-of-pocket for $7,850 in pocket, and almost $14,000 for in-network and out-of-network. Now, although only one provider officially is in their network, he could technically possibly use this plan out-of-network for his other doctors if he wanted to. So we'd have to go into kind of more detail there. The one unique thing about this plan, it has a give back program, which puts money towards your Medicare Part B premium. So in this case, this client would get $97 back per month towards their Medicare Part B premium. So again, what I like about this plan is the medication cost is $2,000. It's still high, but it's lower than $10,000. It covers one of his doctors, possibly the other one's out of pocket or out of network. And again, I think it has this give back option. So there's some good things about it. What I don't love about though is this max out of pocket. I also think that medication cost is relatively high for a Medicare Advantage plan. I think that there could be better options. But again, for our client, I would show him, here are the two things that I would consider when it comes to Medicare Advantage based on your medications, your doctors, and the overall costs of your plan. Now, I would then say, okay, well, client, you are open to original Medicare. Let's look at those costs as well. So when you're on original Medicare, we're going to look at your Medicare Part D drug costs. So for Medicare Part D, again, same medications, levothyroxine, rovastatin, Tresiba. For the lowest cost plan for him on this, it's called Humana Premier RX plan. This is a monthly premium of $137.10. It has a $0 deductible for his drug coverage. And the total cost between medications and medication copays and Part D plan premiums is $1,790.96. This client does not meet their deductible because the deductible is $0, so technically January 1, they're going to hit it. And they're not going to hit their catastrophic cap of $2,100 per the lower left-hand corner, okay? This plan actually does cover Tresiba, which is great, but there's no prior authorization or any other issues. So for this plan, the client can get Tresiba on a quarterly basis for $104.99. So again, the 137 times 12 plus the 104.99 times 4 gets us to the $1790.96. Okay? So that's their cost with Tresiba. Again, if the client does not need Tresiba, it's a different story. For example, the lowest cost plan in this client's area is WellCare Value Script. It has a $0 monthly premium. However, Tresiba is not covered underneath this medication, underneath this plan. So this one would cost him $8,652.44 at CVS because he's paying all of those medication costs out of pocket. The $2,100 medication cap for the calendar year does not apply to non-covered medications. So while this WellCare plan has a lower premium, it will cost them so much more for their medications. So my recommendation would be pay a higher premium to have a lower cost. Yes, he's paying an extra $140 a month for premiums, but his total out-of-pocket cost for medications is about $6,000 less. I think it's probably worth the trade-off. So the next step is trying to decide which Medicare supplement plan fits this client best. Now, you've seen in other videos, I've talked about the supplement plans have different letters in most states, and the different letters have different coverage details, but also different costs. So for each client, I want to understand, what are your priorities? Is your priority lowest premium? Is it lowest risk? I want to know, do you have upcoming surgeries? Are you moving? Again, overall, what is happening in your life and your future life that could impact how we think about the best Medicare supplement plan for you? Now, for this client, I'm showing them 2 examples. Again, these are not the best companies for everyone. This happens to be the best companies in his situation. And I lay out all the costs for him. So on the left-hand side, I have a Cigna Plan G. Again, I cover these letters in more detail in other videos, but I'm going to kind of talk about how we compare costs here. So when I talk to a client, I say, okay, maybe you should consider Cigna Plan G. Your Medicare Part A is nothing a month. Your Medicare Part B, at least this year, is $202.90. Your Medicare Part D plan that I just highlighted is $137.10 a month. And the Plan G for you with Cigna is $132.60 a month. If you add up all those costs on a monthly basis per person, it is $472.60. Times it by 12 for your annual total is $5,671.20. So if they're on Plan G and given the medications, I would expect that you're on a premium basis, you're going to pay $561.70. Now, I don't want to end the calculation there because I know there's more costs in Medicare than just the premiums. And when we work with our financial planner clients, people who are financial advisors, we want to understand what's the total cost, what's the total risk, so we can plan for that in retirement or as you're still working, whichever one it is. But for a Plan G, if we go to the section down below, it says in a high cost year, your maximum exposure is $5,952. So that is your total premiums annualized across the 12 months, plus your $283 for your Part B premiums. Now I'm going to go one step further. I'm going to say, okay, well, I know that my client's medication copays is $419.96 a month. That is the $104.99 times $104.99 times 4 months, right? Because I already have the premiums included somewhere else. So in that case, I'm going to look at all-in costs. This client on a Plan G and a high cost year, they have a ton of medical costs. They can expect to pay $6,374.16. Now let's go to High Deductible G. I usually compare more plans than just this, but for this example, I'm going to just show you this for somewhat simplicity. But if they were to go to Plan G, as you'll see, everything else is the same besides the High Deductible G premium. So $0 for Part A, $202.90 for Part B, $137.10 for Part D. And in this case, the High Deductible G supplement plan is $48 a month. So that comes out to $388 a month in terms of premiums. Times it by 12 for your annual total is $4,656. Now the High Deductible G deductible for 2026 is $2,950. So in a high cost year, you can expect to pay the premiums, the annual premiums of $46.56, plus your deductible of $2,950, which comes to $7,606. Now we also have medication copays, which again for this client is $419.96. If you add that together, it's around $8,000 if you're on a High Deductible G in a high cost year. So again, in a high cost year, you will pay more on a High Deductible G. But in a low cost year, if you're healthy, there is a difference of what? $2,600, $700 in premiums. So our clients have to decide, are you better off paying less in premiums with a higher cost if you do have health costs, or vice versa? In this case, it's about a 50-50 trade-off, right, between High Deductible G and G. The key, though, here again is that in most states, it is hard to change these supplement letters or supplement companies in the future. So we have to think about long-term implications when it comes to these plans. Now, our client still wants to get Advantage. Perfect. So on the right-hand column in red, I have a Blue Cross Blue Shield Medicare Advantage plan that I talked about before. So in this case, the Part A is $0. The Part B is $202.90. The Medicare Advantage premium is $0 in this case. So the total cost is $202.90. Annualized $2,434.80. Now, we can't forget about max out of pockets, because if you do have health issues, you are on the hook for that max out of pocket. And in this case, I grabbed the client's lower out of pocket costs. I can show it to you, right? Actually, there's only one here. But if you look at his out of pocket costs, it's $9,250. So if we add that onto the premiums, our total out of pocket costs, what we'd estimate for the calendar year, is $11,684.80. You also have your medication copays, which is $10,392.96. Brings this person out to $22,000. That's a lot of money. Now, one could say, well, he's never going to hit his out of pocket. Okay, fine. Maybe he won't. But even 50% of the out of pocket, you're still at what? Minus $4,000. You're at like $18,000. So if your doctor says, we take Blue Cross Blue Shield, and you're like, okay, I'll take that one, that may not be the best option for you. Again, your medications could impact which Advantage plan fits you best. And it also impacts how you compare costs across all the plans. Now, one could say, well, Emily, maybe this plan, we're not going to do Advantage plan, or we're not going to do the Blue Cross plan. Let's look at the Humana plan, right? The Humana plan was the lowest cost plan for this client's medications. So I've updated the column on the right to go to Humana Choice Giveback. In this case, he'll still pay $0 for Part A. For Part B, it's $202.90, but this plan is a $97 give back, so it decreases his amount. So the monthly premium is $105.90. Great. Annual total, $1,270.80. Okay, great. But now we have to add on that max out of pocket. Now, this one does have an in-network and an out-of-network out of pocket. I use a smaller amount. So if I add his premiums plus the lower out-of-pocket costs, you're at $9,120.80. Plus $2,000 for medication copays, and you're close to $11,000. So my point is this. Even with the lower premium plan with the copays, if you look at a high out-of-cost year, Advantage plans are much more expensive than your other options. Now, this could be different, again, based on the client's doctors or this client's medication costs, but it's all going to be customized to you. But we have to look at total costs. And again, even if you don't assume that you're going to hit all the out-of-pocket costs, even half of them, usually Advantage plans are still quite a bit more expensive. Not always, but usually. Now, some places like Kaiser only take Kaiser Medicare Advantage. So your option is Medicare Advantage through Kaiser. And that's fine in that situation, right? But again, the key to comparing plans has to start with you. What are your goals? What are your priorities? What's important to you? All those factors. And then decide from there what makes the most sense. Now, there are some people who literally cannot afford anything. And so they have to do these give back plans that have a lower premium. And they just hope that they never have any medical copays, right? And I hope that they don't either. For the people who we tend to work with, most of them have saved for retirement. Most people that we work with have priorities over their doctors. They understand costs, and they really want to get the best overall plan, knowing they might have to pay a little bit more on a monthly basis. So the majority of our clients, not all of them, do fit better in a Plan G, a High Deductible G, or other supplement plans rather than Medicare Advantage. Not always, but usually. But please look at the costs, because the premium costs can be very deceiving. Even the out-of-pocket costs in some ways can be deceiving. We have to look at the details to understand what is driving it and what makes the most sense for you. So when it comes to Medicare, again, it can be great. It's a lot. I get it. I was overwhelmed too when my dad and I first went through this, but it can be great. So do the analysis, get Medicare right the first time because of Medicare's guarantee issuance rules. It is not easy in most states to get a Medicare supplement plan after you first join Medicare. So you want to get it right initially to have that best coverage for both now, but also 30 years from now. So I hope this helped you. Again, make sure you follow along for more inside tips so I can help you easily make your right Medicare decision.